When drug abuse comes to mind, we often conjure up an image of a down-the-luck crack addict or heroin junkie that is taken to the streets because of their addiction. What we actually perceive drug addicts to be is actually far from the real picture. Drug addiction today presents itself as a much different image, that of the ever-growing epidemic of prescription drug abuse. We often think of famous cases like Michael Jackson and other famous celebrities who died of prescription drug overdose or misuse, whether it was their own fault or the fault of another. But you don't have to be related to a celebrity to see what an impact prescription drug abuse can have. Drug abuse is one of the biggest problems that the Medicare and Medicaid system faces, along with those personally affected by it. It could be your friend, it could even be your mother, your father, your brother or sister, even a grandparent. Although, when we often think of prescription drug abuse, we think of depressed teenagers stealing drugs from the medicine cabinet. Oddly enough, this is not always the case with prescription drug abuse. The elderly are also at risk for prescription drug abuse or dependency. With an ever-aging baby boomer population, we should expect to see an increase in seniors becoming addicted to prescription medications in the coming years. According to a study, those 50 years and older in the years 2006 through 2008 that had used some type of illicit drugs, prescription drugs made up over 33% of narcotics use in these older adults. Many of these 50-year-olds and over will in the future be on some form of Medicare or government health service. We do not need a drug problem forming in these older Americans. One thing to keep in mind is that many of these people are baby boomers. They grew up in the 60s, which was a time of turmoil and social revolution. This is where many of them had their first experience with drugs. According to the article, Elderly at Risk for Prescription Drug Abuse, from drugfree.org, between the years 1997 and 2008, people between the ages of 65 and 84, the rates of admissions for prescription drug abuse and illicit drug abuse climbed to 96%, and those over the age of 85, admissions rose to 87%. This is a rather alarming rate for our elderly to become afflicted by. A big problem with prescription drug abuse is that the actual access to them through various means. One way is Medicare Part D plan. Even though the Medicare Part D plan is very effective in giving seniors access to affordable prescription drugs, it has a drawback. It lets people who would take advantage of the system doctor shop. Doctor shopping is where a person goes to multiple doctors, usually in search of painkillers that would, under normal circumstances, would only be allowed the normal dosage of medicine or painkiller. By going to multiple doctors, they can get multiple prescriptions for themselves for illicit purposes. A recent article, Gary Woman Accused of Fraud to Get Controlled Substance, from the Northwest Indiana Times, stated that a young woman from Gary had been doctor shopping. She had visited 34 different doctors and used 10 different pharmacies to get 100 hydrocodone and oxycodone prescriptions filled. An ER doctor at St. Catherine's Hospital in East Chicago, Indiana, had noticed her in the ER on several occasions. This type of drug abuse fraud costs the Medicare and Medicaid systems millions of dollars each year and keeps people addicted to prescription painkillers that are being illicitly used. For more information on how we can help end prescription drug addiction, please visit www.medlineplus and look up prescription drug abuse for tons of info on this epidemic. Thank you for listening to my slideshow. This is Ben Pugh, signing off.